Known for her incredible talent and distinctive beauty, Emma has captured our hearts since her breakout role in Superbad and her Oscar-winning performances in La La Land and Poor Things. Join me as I take a closer look at Emma Stone's facial transformation over the years. Estimated costs of potential procedures are provided at the end of the video. In 2007, at the age of 19, you can see here that Emma has that distinctive infrabrow fullness of youth. She has a prominent orbicularis oculi muscle right here at the bottom of her lower eyelid. Now, this is not fat herniation. This is actually just a prominence of a portion of the orbicularis oculi muscle that encircles our eye. When I look at her nose, I see a supratip break, and that's the area right over the tip that has a slight depression before you enter the bridge of the nose. Also, she has some tip bulbosity because of the curvature of the lower lateral cartilages, which is very common. When I look at her mouth area, she has a short philtrum, that area right at the base of the nose, between the base of the nose and the center of the Cupid's bow. And she has some upper tooth show when she just parts her lips. Emma also has a strong facial bony structure, both in the midface as well as the lower face. In 2008, at the age of 20, when you look at Emma's eyebrows, what you see is that they're starting medial to the medial canthus, and they're ending lateral to the lateral canthus. And that's a pretty standard type of orientation. Also, the eyebrows are very close to the orbital rim, but as you get out to the peak of the eyebrow, it does come up a little bit higher than the orbital rim, which is a very feminine trait. And the tail of her eyebrow is higher on the x-axis compared to the head of the eyebrow. And I think one of her most distinctive traits is that when she smiles, you see that the lateral upper lip has some inversion, or it curls in, and you can actually see all the way out to her premolars. In 2009, at the age of 21, you can see that Emma has a fairly rounded forehead, and this sometimes gives the illusion of a higher hairline. Some people come to me and they're looking to potentially lower their hairline, and we measure the horizontal thirds of their face, and then we realize that actually the middle third and the lower third of their face is very similar in height to the upper third, but the difference is that some people have a lot of roundedness, and that sometimes makes it look like the hairline is higher than it actually is. And perhaps this is why we often see Emma covering up part of her forehead with a hairstyle. So frequently the hair is falling to the left side of the forehead. So this creates a smaller appearing forehead. And there's nothing wrong with having a high hairline aesthetically in general. But for people who are looking to potentially lower their hairline, the two main options for women specifically are surgical hairline advancement or forehead reduction, which is a surgical type of cut, and we have a video on the channel. And the other option is a hair transplant, where the hair is taken from the back of the head, either with FUE or FUT technique, and brought over to lower the hairline. Now, that's a very subjective type of matter, right? Whether someone's forehead is too large. And I think the spectrum is very wide for what beautiful looks like. And I think Emma is surely beautiful with the way that she looks now and doesn't need any type of lowering. But some people will choose to get the hairline lowered to reduce some of that roundedness of their forehead. In 2010, at the age of 22, I see no change, and that's the same through 2012. In 2013, at the age of 25, I'm seeing that there are some signs of a potential rhinoplasty procedure. You can see that there's increased nostril show, both on frontal view as well as the 3/4 view. And also, the tip to me looks more refined and it appears slightly more lifted or rotated. Anytime the tip gets lifted, in technical terms, we call that increased rotation. And then when it gets brought down, that's called derotation of the nasal tip. And I'm also seeing some signs of potential lip filler introduced around this time. Now, given her baseline anatomy, like we talked about, the lateral upper lip has some curl in. So it looks like perhaps they were trying to fill in that area with some lip filler. Now, what's common as you start to overfill that lateral lip, you sometimes get migration beyond the vermilion border. And since we now know that filler in the face can last a very long time, sometimes for many years, even a decade plus, you can get migration that occurs many years after the initial injections, even if you don't continue getting filler. And sometimes, even if you get it dissolved, some aspects of the filler might still be left behind because a lot of times the filler is not dissolved as extensively as it maybe should be or can be. So you can get this kind of spillover effect outside the vermilion border. So what I always say for people who are getting injections, make sure that the volumes are kept low and that they're placed tastefully and that you're not getting too much filler close to the vermilion border where you're then at risk of potentially having that migration occur into the cutaneous portion of the lip. But I think now people are starting to realize the ill effects of overfilling, and people I think are overall using smaller quantities of filler and injecting generally less often, which I think is a good thing overall. In 2014, at the age of 26, I wanted to point out here that though Emma is not a natural redhead, it's worth noting that redheads typically have more fair complexions. And because of that, they're more susceptible to sunburns and also potentially to even skin cancer. So if you're a redhead, don't forget to use sunscreen regularly. And for sensitive skin, make sure to check out our Feel Confident products because they've been thoroughly tested specifically on sensitive skin. In 2015, at the age of 27, I see no change, and that's the same through 2020. In 2021, at the age of 33, Emma was pregnant around this time, and it does look like she had some additional fullness to her nose and, of course, to the rest of her face during the pregnancy, which is very normal. And on TikTok, there was a trend recently called pregnancy nose. And this is just to point out that the nose does get larger during pregnancy. Hormones that are released during pregnancy can dilate blood vessels. And this is generally intended for the uterus to help support, of course, the growth of the baby, but it can also affect other body parts, including the nose. So not only can the nose appear larger, but it can also cause some internal congestion and can sometimes increase the incidence of nosebleeds. In 2022, at the age of 34, Emma has now lost some of that weight post-pregnancy, and she appears very similar to how she did in 2018. Given the weight loss, I am seeing a more pronounced transition now from the frontal bone to the temporal fossa. As people lose weight, sometimes the fat component in the temporal fossa will also decrease. And as that happens, you can see these different bony transitions more prominently than you may have when you had a little bit more weight. In 2023, at the age of 35, I'm seeing some signs of a potential upper blepharoplasty. And I was also thinking initially that perhaps there was a brow lift done, but as I continue to look at more recent photos, I think that it was most likely just some removal of excess upper eyelid skin rather than the entire brow complex being lifted. Sometimes those are done together, a brow lift with an upper blepharoplasty. Sometimes only a brow lift is performed, and other times an upper blepharoplasty is performed in isolation to remove some of that hooding of the upper eyelid. I also think that Emma started to introduce some Botox around this time to the usual locations like the forehead, the glabella, and the crow's feet. Botox is great for anti-aging in the right setting, but make sure not to forget about excellent skincare. We have a video on simple, basic AM and PM skincare routines that are great for men and women alike, so make sure to check out that video. And in 2024, when I compare back to 2009, what I'm seeing is that the upper lip now has more general volume. And now we're getting closer to a 1-to-1 upper to lower lip ratio. And as we discussed earlier, I am seeing some filler migration that's going beyond the upper vermilion border. The total cost of these potential procedures is $65,000. What do you think about Emma Stone's transformation? Do you think she's all natural, or do you think she may have had some help from cosmetic procedures? Please leave a comment with your thoughts below.